Hola, muy buenos días, buenas tardes. Gracias por conectarse a esta sesión informativa de la Organización Panamericana de la Salud sobre la pandemia por COVID-19 en la región de las Américas, este miércoles 11 de agosto. Soy Sebastián Oriel del Departamento de Comunicación de la OPS y como cada semana, esta sesión durará alrededor de una hora. Ya hemos recibido sus preguntas por correo electrónico y también podrán hacer preguntas en vivo y a través del chat mediante el botón Q y A. Les pedimos siempre incluir su nombre y el medio de comunicación al enviarnos sus preguntas. También les recuerdo que contamos con interpretación simultánea al inglés, portugués y francés y que pueden optar por cualquiera de ellas dando clic en el botón Interpretation. Hoy la directora de la OPS, la doctora Carissa Etienne, informará sobre la evolución de la pandemia en las Américas y sobre una nueva oportunidad para la adquisición de vacunas COVID para los países de la región a través del Fondo Rotatorio de la OPS. Acompañan a la doctora Etienne en la sesión de hoy el doctor Jarbas Barbosa, subdirector de la OPS, el doctor Ciro Ugarte, director de Emergencias en Salud en la OPS, y el doctor Silvana Aldiguieri, gerente de incidentes para COVID-19 en la OPS. Ahora sí, entonces quisiera invitar a la doctora Etienne a que nos comparta su actualización regional en el día de hoy. Doctora Etienne.
Thank you, Sebastian, and good morning, and thank you for joining today's briefing. Over the past week, more than 1.3 million COVID-19 cases and more than 19,000 COVID-related deaths were reported in the Americas. Cases and deaths continue to rise in Canada, Mexico, and the United States as adherence to public health measures relax, the Delta variant circulates, and vaccination coverage varies within countries. In Central America, cases are falling in Panama and Costa Rica, but rising in Honduras, Belize, and El Salvador. Deaths are rising in nearly every country in Central America, including a 30% increase reported in El Salvador. In the Caribbean, we are witnessing a similar story in the more populous islands. Cases are rising in Cuba, Jamaica, and Puerto Rico, as well as in Martinique and the Bahamas. Over the past month, infections increased 30-fold in Martinique, and there has been a significant spike in hospitalization. In Dominica, cases are rising as well. The trends are more promising in South America. There has been an overall decline in cases and deaths in the Andean region, and also Brazil, and across the Southern Cone. This includes substantial drops in cases in Colombia, Bolivia, Paraguay, and Uruguay. Although cases are surging in some areas, there is clear evidence that wherever vaccines are available, they limit severe illness and save lives. And that is why increasing access to vaccines remains our top priority. It is not just for some countries, but for all countries. More than 6 months after the first doses arrived in our region, the disparity in who can access vaccines and who cannot is unacceptable. Fewer than 20% of people in Latin America and the Caribbean have been fully immunized. And in some countries, that number is less than 5%. But this disparity is also dangerous. There is no path to recovery for any country while its neighbors remain vulnerable and while variants circulate and multiply. We must banish the idea that vaccine inequity is the problem of some countries and not others. And instead, we need to work together to find solutions for all countries. And we must do it quickly because lives hang in the balance. The region of the Americas has a legacy of strong immunization programs and strong immunization coverages. Historically, the Americans have enjoyed high rates of vaccine coverage throughout our member states, regardless of their income or infrastructure. We have strong immunization programs that are built on decades of delivering vaccines for polio, measles, seasonal flu, and yellow fever, among others. We also have an experienced health workforce that are trained to administer vaccines safely and adept at reaching our most remote communities. Perhaps most importantly, countries in the Americas have access to the PAHO revolving fund, which is an integral part of our technical cooperation package, consolidating country vaccines demand from 41 member states and territories to leverage more affordable pricing and ensure the availability of high quality vaccines to reach every corner of our region. For decades, the revolving fund has been a catalyst of equity and solidarity and has been responsible for protecting generations of children across Latin America and the Caribbean from vaccine-preventable diseases. Thanks to these systems and expertise, we are uniquely positioned to deliver COVID-19 vaccines quickly, safely, and equitably. We are living in a constrained global vaccine market. Throughout the first 6 months of this year, most countries in Latin America and the Caribbean have been unable to access enough vaccines. Some countries managed to strike bilateral deals with the vaccine makers and have made important progress immunizing their populations. Others are beginning to benefit from donations from countries with additional doses. These donations are more than a display of solidarity. For some countries, they are the only hope of saving lives, and we need more donations. PAHO's revolving fund has been working in 3 key areas to increase access to COVID-19 vaccines. First, the fund is purchasing and delivering vaccines on behalf of the COVAX facility. Second, it has been delivering vaccines donated through COVAX and supporting bilateral donations when requested. And third, it has been providing complementary access to vaccines to achieve high coverage to control the pandemic. All of these are efforts that are focused on diversifying opportunities for countries to access the doses they need in the fastest and more effective way possible. But the region is still short of the doses needed to turn the tide of the pandemic. We need a significant influx of vaccines and a more equitable process for distributing them. There is a new opportunity to access vaccines. So with this in mind, I am pleased to announce that PAHO is offering our member states a new opportunity to access COVID-19 vaccines. The revolving fund is now receiving requests for countries in the region for COVID-19 vaccines for the last 3 months of 2021 and for the calendar year 2022. So far, more than 20 countries have formally expressed interest, and the number is growing by the day. And here's why this is so important. The revolving fund is a mechanism for providing high quality vaccines at competitive prices and prices that countries can afford. It also provides support with planning, cold chain development, syringes, and other supplies. This new initiative with the revolving fund will make available tens of millions of COVID-19 vaccine doses beyond the 20% that COVAX offers, and it will complement bilateral deals and other existing avenues for countries to access vaccines. It is an initiative that will benefit every country in the region, but especially those that lack the resources and the negotiating power to secure the doses that they need to protect their people. PAHO already monitors immunization coverage closely, and we are now rolling out a new system that collects the vaccination needs of each country faster and more efficiently. This will help ensure that better deals can be closed with manufacturers and that available doses are distributed equitably based on the latest epidemiological and vaccine coverage data. Our region needs to pursue all possible avenues to expedite access and to ensure that countries reach their vaccination goals. We still need more donations, and we still need COVAX to deliver on its original commitment. We also need to create new opportunities that meet the diverse needs of our member states and that increase the supply of vaccines to the people and communities who are at the greatest risk. This has long been the mission of PAHO and its revolving fund. And we vow to work tirelessly to achieve a sustainable supply of COVID-19 vaccines for all of our countries.
Muchas gracias, doctora Etienne. Vamos a pasar ahora a responder a las preguntas que nos han enviado por correo electrónico y también las que estamos recibiendo a través del QIA. Recuerden identificarse con su nombre y medio de comunicación al enviarnos sus preguntas. La primera pregunta nos llega de Gebrick Alvarado, de Newsday en Trinidad y Tobago, y dice que en su país actualmente avanza la vacunación con Sinopharm, pero hay pocas personas en los centros de vacunación. Pregunta, ¿qué recomienda la OPS a las autoridades para incentivar a la población a vacunarse? Doctor Barbosa.
Gracias por la pregunta. Mira, apesar de que la vacuna efectivamente es la mejor herramienta que tenemos, primero para salvar vidas, protegiendo los más vulnerables y después para lograr el control de la transmisión, todavía hay grupos de personas que tienen dudas de vacunarse. Yo creo que es muy importante primero escuchar bien, buscar identificar cuáles son estos grupos, cuáles son las dudas que tienen y que los ministerios de salud puedan brindar toda la información a essas pessoas. A OPS está trabalhando com os ministérios de saúde para brindar cooperação técnica em los temas de comunicação. Esta não é uma campanha de vacunação rutinária igual a las outras. Desafortunadamente, as vacunas, como outras medidas também, foram muito politizadas. Há como um debate político sobre se as mascarilhas podem se usar ou não, se as vacunas funcionam ou não. Ou seja, isto há que afrontar de uma maneira muito direta, involucrando a própria sociedade, os periodistas, os profissionais de saúde, brindando todas as informações. Os dados que temos hoje, e já se tem mais de 4 mil milhões de doses de vacunas aplicadas em todo o mundo, são dados que não permitem nenhuma dúvida. As vacunas estão salvando vidas, as vacunas reduziram a mortalidade de maneira dramática em los países que estão utilizando as vacunas reduziram a hospitalização, as vacunas podem salvar vidas. Não é possível que com uma ferramenta como essa disponível, vamos a seguir com pessoas a morir, com pessoas a ir-se a los hospitais, a la terapia intensiva, quando é possível prevenir. Então, eu creio que é necessário uma abordagem ampla do tema, buscar comunicação, buscar estratégias adequadas a cada grupo, involucrar, compartilhar os dados e as informações para que todos possam fazer a melhor decisão para sua vida e para sua família e para sua comunidade. Tomar as vacunas. Gracias.
Gracias, doctor. Siguiente pregunta es de Inés Capdevila de La Nación en Argentina dice: ¿por qué la variante Delta tarda más en explotar en América del Sur que en otras regiones del mundo como Europa u Oceanía? Y también María Mena de Bolivia verifica, quiere saber qué se sabe de la efectividad de las vacunas anti-COVID contra la variante Delta y si pueden las vacunas dar lugar a nuevas mutaciones, como dice que se indican diferentes medios y redes sociales. Doctor Aldiguieri.
Sí, gracias. Son realmente dos preguntas de ámbitos diferentes. Cuanto a la primera pregunta, el fenómeno de introducción y desplazamiento de variantes del virus SARS-CoV-2 en una subregión, en un país o en un territorio es un proceso muy dinámico donde muchos factores, tanto biológicos como epidemiológicos, pueden jugar un papel determinante. Tal vez aún es temprano para predecir el verdadero impacto que pueda tener la variante Delta en América del Sur, teniendo en cuenta que en el recién pasado otras variantes, como la alfa, también con una elevada capacidad de transmisión, otras variantes predominaron solo de manera transitoria en algunos países y posteriormente fueron desplazadas, reemplazadas por otras, como la variante Gamma. También es probable que la intensa transmisión previa de otras variantes hayan generado una protección cruzada que disminuya en algo la velocidad de transmisión después de la introducción de la variante Delta. Sin embargo, al día de hoy, mitad de agosto, se ha visto un rápido incremento de la transmisión comunitaria de Delta, principalmente en México, en Ecuador y en Brasil, por lo cual debemos permanecer en alerta, fortalecer medidas de protección y control en salud pública y, por supuesto, incrementar el acceso a la vacunación. Todas esas medidas que siguen siendo efectivas para proteger y evitar la transmisión de cualquier variante del virus. Cuanto a la pregunta de Bolivia sobre vacunas y sobre mutaciones. Por supuesto, se precisan más estudios a fin de determinar cuáles son los cambios en efectividad de las vacunas actuales contra la variante Delta. Sin embargo, es importante destacar que hay cada vez más datos que indican que la mayoría de las vacunas estimula suficiente inmunidad para mantener un alto nivel de eficacia contra la mayoría de las variantes. Y sobre todo, protegen contra la enfermedad grave, la hospitalización y la muerte. Finalmente, quisiera insistir que son los altos niveles de transmisión, quiere decir la replicación del virus SARS-CoV-2 en seres humanos, que favorecen las mutaciones. Una alta tasa de vacunación es la mejor arma contra la aparición de mutaciones en el virus. Espero haber respondido a las dos preguntas. Gracias.
Gracias, doctor. La próxima pregunta es de Nicole Chapur, de Bloomberg News en Venezuela. Pregunta si tiene la OPS una fecha estimada para la llegada del primer cargamento de vacunas a través de COVAX al país. Dice que tanto el gobierno como la OPS mencionaron preocupación por la detección de la variante Delta en Venezuela. Sin embargo, en el reporte de actualización epidemiológica del 8 de agosto, dice que Venezuela no parecía haber reportado ningún caso hasta el 4 de agosto y pregunta si existe algún problema para la confirmación de estos casos y si sabe la OPS cuántos casos de la variante Delta se han detectado en el país. Doctor Ugarte.
Muchas gracias por las preguntas. Aún no hay una fecha específica sobre la llegada de las vacunas, pues están completando algunos pasos administrativos necesarios entre COVAX, el gobierno y también la OPS. Si todos estos pasos se se aceleran y se completan en los próximos días. El primer envío debería llegar hacia fines de agosto y correspondería a las vacunas de Sinovac y seguidas de las vacunas de Sinopharm hasta completar todas las vacunas comprometidas por COVAX en esta ronda de distribución. Respecto a la variante Delta, el gobierno confirmó la presencia de la variante Delta en el país. Debido a que esto es dinámico, el número de casos o de muestras detectadas con variante Delta y la ubicación es todavía variable, y entonces estaremos atentos a la próxima actualización del gobierno, porque existen las condiciones y la capacidad para poder detectar las variantes, tanto de la toma de muestras como también para la reconfirmación en laboratorios de referencia internacional. Gracias.
Gracias, doctor. Con respecto al reciente anuncio que hizo la directora de adquisición de vacunas a través del fondo rotatorio de OPS, tenemos varias preguntas. Daniel Politi del New York Times en inglés dice, could you please give more details on the revolving fund for COVID vaccines? Would PAHO negotiate directly with the manufacturers on behalf of countries in the region? Is there an estimate on how many vaccines this could involve, and why is this being launched now? También Jason Bouvier de National Public Radio en Estados Unidos pregunta en inglés, does the new offering from the revolving fund represent the future of collective purchasing of COVID vaccines in the region? Why not do this through COVAX? Dr. Barbosa.
Thank you for these many questions about this new initiative that our director announced today. First, let me clarify that it's not a revolving fund for COVID vaccines. The revolving fund for vaccines is working in the region for 42 years now. Only last year, in 2019, the revolving fund provided more than 400 million units of vaccines, syringes, and other cold chain devices to the countries in the region. The revolving fund is the main source of vaccines for the countries in Latin America and the Caribbean to their immunization programs. The revolving fund has purchased vaccines against polio, measles, pneumococcus, meningitis, and many other vaccine-preventable diseases. About COVID-19 vaccines, the revolving fund has a triple role. The director mentioned this, I just want to highlight. The first role is that the revolving fund is one of the two purchasing mechanisms on behalf of COVAX. So PAHO's revolving fund and UNICEF works together to make the purchases after the COVAX facility has the agreement with the producers. So PAHO's revolving fund has deployed now for Latin American and Caribbean countries more than 20 million doses on behalf of COVAX facility. The second role is that the PAHO's revolving fund also is deploying the donations through COVAX and supporting and facilitating bilateral donations. This new initiative that the director announced is aiming to offer another alternative to the countries. Let's remember that COVAX facility offered to the countries that are participating in the mechanism, that COVAX will deploy vaccines around 20% of the population. This is very important because this will protect the most vulnerable population. But to reach the control of the transmission, the countries needed to go further than 20%. And it is not clear if COVAX facility will offer more vaccines after this 20%. For this reason, we started a negotiation with the producers, and we only negotiate with producers that have the emergency using list authorization from WHO, so we are talking about high quality vaccines, and we offer this opportunity to the countries that want to increase their coverage. So the countries will have COVAX facility. They will have, some countries will have also the bilateral agreements that they have, and also this opportunity to increase the vaccination coverage to reach out the 70 or 80% that is needed to control the transmission. So this is the new initiative, and it is open to all countries in the region that are members of the revolving fund. We have received the first estimation of the countries for the last quarter of this year. We are now working with the countries, clarifying some aspects. We are also working with the producers to close the agreements to start delivering on the last quarter of this year. Sobre Venezuela, sim, Venezuela pode ter acesso a essa iniciativa del Fondo Rotatório. En las negociaciones que se hacen en Venezuela está la posibilidad de pagar la deuda que tiene Venezuela con el Fondo Rotatorio, y además para las compras del Fondo Rotatorio, eso se va a buscar, né, entre los países que están informando que têm interesse em participar, também se pode oferecer outras possibilidades de apoio financeiro. Pero, em princípio, todos os países podem participar, pero recuerden que sempre vão ter que pagar essas vacunas, ou seja, que também Venezuela vai ter que fazer o esforço de buscar fundos adicionais para que se pueda cobrir todos os custos e ter acesso a essa nova alternativa que vai complementar os esforços que os países já estão fazendo. Gracias.
Muchas gracias, doctor. Próximas preguntas, Shersin Carter de Nation News en Barbados y también Daniel Colling de TN23 en Guatemala. Shersin en inglés pregunta, how worrisome is Delta variant in the Caribbean? Y Daniel dice, ¿qué acciones debe adoptar Guatemala para frenar el alza de casos de COVID-19, tomando en cuenta que se ha confirmado la variante Delta en el país? Doctor Aldilleri.
Thank you for these two questions. I will answer separately the questions. Regarding the questions from the Caribbean, what we know is through reports through the International Health Regulation Channel, the Delta variant has been detected in 28 countries and territories in the Americas, including countries of the Eastern Caribbean and countries of the Guyanese Shield. So namely, Anguilla, Aruba, Barbados, Bonaire, Curaçao, French Guiana, Guadeloupe, Martinique, Saba, Saint Martin, Suriname, and the US Virgin Islands. While Delta has been mostly associated to travelers in Latin America, several other variants currently co-circulating are associated to community transmission in the Caribbean, including the variants of concern Alpha and Gamma and other variants of interest. As of today, the transmission of Delta variant has increased, particularly in Mexico, where it was detected in more than 31% of the sequence samples during the last 8 weeks. In Ecuador, with more 8% of the sequences reported during the last 2 months. And in Brazil, where it is increasing in different states, although still far to become predominant. Introduction and replacement of lineages of variants is an expected event, and we still do not know exactly what the impact of Delta is going to be in Latin American countries. Nevertheless, it is important to note that the dynamics of the virus is a multifactorial event, and it does not occur only because of a higher transmission capacity of the virus. Therefore, we must insist that efforts to control the epidemic should be focused on trying to reduce the transmission regardless of the variants by implementing and maintaining all available tools that we have and that have demonstrated being effective including the use of masks, social distancing, and, of course, access to vaccines. Ahora, la pregunta de Guatemala sobre la variante Delta. Aunque se ha demostrado que la variante Delta tiene una capacidad de transmisión muy elevada cuando se compara con otras variantes de preocupación, como la variante alfa o la variante gamma, aún no existe evidencia sólida para afirmar que es más peligrosa o que puede llevar más fácilmente a la muerte. Se requieren más estudios para determinar el verdadero impacto en hospitalizaciones y en la gravedad de la enfermedad asociada a esa variante. En cualquier caso, todas las medidas de control en salud pública que han sido utilizadas hasta el momento, incluyendo el uso adecuado de mascarilla, incluyendo el distanciamiento físico, el aislamiento de contactos y otros, todas esas herramientas han demostrado ser efectivas para disminuir la transmisión de esa variante Delta y de todas las variantes que están circulando en este momento en este continente. Por lo cual, es hacia ahí que deberían enfocarse los esfuerzos para detener la transmisión y el aumento de casos. Asimismo, las vacunas que han sido licenciadas por la OMS han demostrado ser efectivas contra Delta y las demás variantes, disminuyendo, y es el mensaje en cada sesión, disminuyendo significativamente el riesgo de hospitalización y el riesgo de muerte. Con eso, sin importar la variante que está circulando, se deben mantener todas las medidas de control y aumentar la confianza en las vacunas y tratar de vacunar a la mayor cantidad de población que sea posible. Espero haber respondido a las dos preguntas. Gracias.
Gracias, doctor. Próxima pregunta en inglés dice, this week the UN launched a new climate report. What are the implications of climate change for health, especially now with this pandemic and planning for future pandemics? Dr. Etienne.
So thank you for this question. I know that we are talking about COVID-19, but this is a very relevant topic as climate change is one of the main threats to health, and combating it is key to achieving the UN Sustainable Development Goals. The IPCC 6th assessment report that was launched this week showed unequivocally that human influence has warmed the climate at a rate that is unprecedented in at least the last 2,000 years. Human-induced climate change is already affecting many of the observed changes, such as heat waves, wildfires, heavy precipitation, droughts, sea level rise, and tropical cyclones. All these environmental changes have direct and indirect impacts on human health. So about 12.6 million deaths each year across the planet, or 23% of the total deaths, are attributable to environmental risk factors. And between 2030 and 2050, climate change is expected to cause an additional 250,000 deaths each year. And that would be due to malnutrition, malaria, diarrhea, and heat stress. Faced with these effects of climate change, people are already getting sick. They are losing their livelihoods and critical infrastructure and being driven to poverty and being displaced from their homes. This increases the demand on health services and creates additional challenges that the health sector must face. Unfortunately, many of these effects will be exacerbated by climate change, with even more devastating effects for health, but mark you, also for the economies and societies. For example, in December of 2019, Hurricane Dorian hit the Bahamas, causing over 70,000 people to be homeless and resulting in what was estimated as over $3.4 billion in damages. That is about 20% of the Bahamas GDP. Air pollution contributes to non-communicable diseases. Extreme high temperatures contribute directly to deaths from cardiovascular and respiratory diseases. And other indirect effects of climate change lead to the increased risk of water and vector-borne diseases such as malaria, dengue fever, and cholera. In our region, among those most affected by climate change are people living in small island development states, children, and also the elderly. For example, projections indicate that over 260,000 people might have to be displaced from Caribbean islands by the year 2100. Some 233 multi-million-dollar tourism resorts would be lost, and 31 CARICOM airports and 710 kilometers of roads would be severely impacted. And this is in addition to the devastating effects of more frequent and greater intensity weather phenomena like hurricanes, droughts, floods, and storms. PAHO works with the health sector to prepare for, respond to, and recover from these impacts. We must build resilient health systems and services with low greenhouse gas emissions and with the ability to adapt to the effects of extreme weather events. In the context of the COVID-19 pandemic, this is also important, but also to face similar future events. So climate resilient healthcare facilities mean safe, green, and climate smart facilities that can continue to be functional in the face of a changing climate and extreme events, from hurricanes, severe storms, to rising sea levels, and prolonged droughts or heavier rain seasons and floods. In the location of new health facilities, countries will have to take all of this into consideration in terms of where they site those facilities to mitigate climate change events. So to achieve all of this, we must also invest in more prevention, or invest more in prevention. Only about 3% of health resources are invested in prevention and health promotion. This is totally insufficient. So PAHO is now coordinating projects with partners to receive and implement funds from the Green Climate Fund and also other donors to increase the ability of health systems to better anticipate, to prepare, respond, but quickly recover from climate events that may harm health. And these investments will serve to strengthen our health facilities to face the effects of climate change and potential future pandemics. The One Health approach has taught us about the complex links between human, animal, and environmental health. And we need to understand these connections and to integrate health and other surveillance systems and to be prepared to act in anticipation to the events that will and can harm health. Lowering our carbon footprint and protecting the environment is protecting our health and that of future generations. I need to reinforce that we need to build strong and resilient health systems with the capacity to respond during emergencies, whether they are linked to climate change or pandemics or whatever. We need to prevent future pandemics that are linked to the disruption of our natural systems while maintaining the ability to keep us healthy and thrive as societies. Climate change is a significant challenge for all sectors and for all of us as human beings.
Gracias, doctor Etienne. La próxima pregunta es de Kadim Joseph, del Observer Media en Antigua y Barbuda. En inglés, pregunta, can PAHO explain why the continued spread of COVID-19, especially among the unvaccinated, could pose major health risk for the region? And is the organization concerned about the recent vaccine-related protests in Antigua and Barbuda and other territories? Dr. Ugarte?
Yes, thank you for that important question, because unvaccinated adults constitute more than 95% of all the new COVID-19 cases that are reported, particularly in health services and hospitals. So in that regards, the vaccination coverage in many of those areas are still at the low or below optimal, particularly in the Caribbean. PAHO has released some recommendations in the webpage on the Eastern Caribbean countries and territories. And the recommendation is that all individuals to get vaccinated when they are offered the vaccine. And this is particularly important for the persons who are in priority groups because of their age, of their type of work, essential workers, for example, or those who have other health risks that may also contribute to a severity of COVID-19 in case they get the virus. And I would like to highlight also, as in related with the question, that the healthcare workers should get vaccinated to protect themselves, but also their patients and their families and the communities. In that regards, the public health measures have demonstrated to be a very good measure to reduce the transmission of COVID-19. So the population must comply with physical distancing at all times, and when it is not feasible, to use masks. And of course, disinfect the hands and be alert of symptoms. In that regards also, PAHO recommends to avoid mass gatherings and in any type of mass gathering, so to reduce the transmission, particularly when there are a high proportion of the population that is not vaccinated. At the same time, we also recommend to analyze the lifting of public health measures according to a risk assessment that must be done not only in the entire country, but in certain areas of countries when the countries are large enough to implement tailored measures, so to reduce the transmission and to be alert of the availability of healthcare facilities, as we have seen in many countries, that the increase of the number of deaths are related with the availability of health services, particularly in high-level transmission, and as has been mentioned previously, because of the presence of the certain variants, like the Delta variant that is more transmissible. So in that regards, it is very important to maintain the public health measures at all times and get vaccinated as soon as possible without delay when the vaccine is offered to you. Thank you.
So as a Caribbean person, I want to add my voice to this because I am truly very concerned about what is happening in the Caribbean. The Caribbean, over many, many years, the Caribbean has been the region, the sub-region with what attained the highest coverage of vaccines. And those are routine vaccines. But what we are seeing now is one, persons totally relaxing on the public health measures and a high level of vaccine hesitancy, where vaccines, even when they're available, that persons are not coming forward. As Ciro said, we are seeing vaccine hesitancy in healthcare workers. I want to make a special appeal to my fellow Caribbean persons to please, we have to be extremely careful. We have limited bed capacity and limited ICU capacity in our small islands. We also, in smaller islands, we have limited expertise in terms of the number of healthcare workers, the number of respiratory therapists, the number of anesthetists. And our health systems will become overwhelmed very quickly. I don't know the sources of the information that is triggering this level of vaccine hesitancy, I can tell you that they are not scientifically proven. And I want to appeal to you to listen to the sources where you have truthful, scientifically based information and evidence. The vaccines work, and the proof that vaccines work, particularly those that received emergency use listing from WHO, it's because in the cases that are now hospitalized, that's in severe illness and deaths, more than 95% of those have not been vaccinated. To be protected, you need to receive the full regimen. If it's 2 doses, you need to receive the full doses. 1 dose does not protect you. And please, the best vaccine for anyone is the one available to you. So please make use of vaccines that are available. But at the same time, please adhere to the public health measures. It is really foolhardy to not adhering to public health measures, not becoming vaccinated in a situation where capacity is limited in terms of hospital capacity. It is really foolhardy. We are playing with our lives. So my appeal to you is get up, wake up from that slumber, wake up from that dream, because we know that the vaccines are safe. They do have side effects. Those are extremely rare. And I want to assure you that we are monitoring the occurrence of those side effects. They're being monitored nationally, regionally, and globally. And there is immediate, immediately we take action, immediate action on side effects so we can prevent any more. But frankly, every medication that you take has side effects. You don't question them. They have side effects. There are new medications that are coming out with new technology that people are taking, and they do have side effects. But the important thing is that those side effects are monitored and reported, and action is taken to address those. So please, please, please take your vaccines, and please wear your mask properly. Social distance. I know we Caribbean people like to be close, 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 and we like fetes and we like to congregate. Please avoid congregation. Wash your hands frequently. Observe the respiratory etiquette and wash your hands frequently. Thank you, my Caribbean people.
Gracias, doctora Etienne y doctor Ugarte. La siguiente pregunta en el chat es de Laura Barros de la agencia EFE y pregunta cuántas vacunas COVID estarían disponibles a través del fondo rotatorio de la OPS, y también quieren confirmar cuándo se estarían despachando esas primeras dosis bajo esta iniciativa. Dice que especialmente porque varios países han advertido que sus pedidos de forma bilateral serían entregados en 2022. Doctor Barbosa.
Gracias por la pregunta, Laura, que permite aclarar también más algunos tópicos. Mira, nosotros estamos en negociación con todos los productores que tienen la autorización de uso de emergencia de la OMS, todos. Y buscamos cuál es la disponibilidad de vacunas que tienen para este año, para el último trimestre de 2021 y para el año 2022. Entonces ya tenemos oferta de vacunas para este año, para el último trimestre y también para el 2022. Los países enviaron hasta la fecha del 30 de julio las estimaciones que tenían para 2021 y para 2022. Estamos ahora en conversación con los países para aclarar algunos aspectos de las solicitudes que hicieron. Los países pueden cambiar su solicitud para 2022 hasta la fecha de 1 de septiembre. Al mismo tiempo, ya estamos en negociaciones con los productores, porque hay que aclarar todas las cláusulas, las condiciones, los precios, el transporte, todo. Pero la expectativa es empezar el envío de esas vacunas para los países que solicitaron a partir del mes de octubre. né? Então, quando se tenga a fecha exata, a quantidade, vamos a informando a cada um de los países. Pero essa é a situação que temos hoje e como nossa diretora ha subrayado, é uma iniciativa que vai complementar, né, que vai buscar fazer com que os países possam ter acesso a mais vacunas para que possam cumprir com uma vacunação, uma cobertura vacunal muito elevada, ao redor de 70%, 80%, que se estima que é o necessário para controlar definitivamente a transmissão, conjuntamente com as medidas de saúde pública. Muitas gracias.
Gracias, doctor. Siguiente pregunta en el chat es de Paulina Alcázar, de Cadena e Infraganti News en México, y quiere saber si los tests de antígenos son efectivos para detectar la variante Delta. Doctor Aldilleri.
Sí, voy a aprovechar esa pregunta para recordar los aspectos básicos de uso de pruebas de diagnóstico. Hasta el momento, el diagnóstico virológico del virus SARS-CoV-2 no se ha visto impactado por la emergencia de variantes. Tantos los ensayos moleculares basados en PCR como las pruebas de detección de antígenos siguen siendo altamente sensibles y altamente específicos para detectar todas las variantes de preocupación, incluyendo, por supuesto, el objeto de la pregunta, la variante Delta. Es muy importante destacar que esas pruebas no sirven para hacer la diferencia entre las variantes. Las pruebas PCR, las pruebas de antígeno, detectan el virus. Se debe tener en cuenta que todos los ensayos de laboratorio tienen algunas limitaciones, tanto biológicas como técnicas, y los resultados dependen mucho del momento en que se toma una muestra, así como de la calidad de la misma muestra, el ensayo utilizado, y también depende de condiciones del individuo y el contexto epidemiológico. En general, no es recomendable el uso de ningún tipo de ensayo, PCR o antígeno, como método para descartar la presencia del virus en personas asintomáticas. Una persona, aún estando infectada y en una fase temprana de la incubación, puede resultar negativa en el ensayo, generando una falsa sensación de seguridad. Los ensayos de laboratorio están diseñados para el diagnóstico en pacientes sintomáticos y, por tanto, se debe tener mucho cuidado al implementarse en ambientes o contextos diferentes, donde otro tipo de medidas de control deberían ser priorizadas. Espero haber respondido a la pregunta precisa sobre la efectividad para detectar variante Delta y también el contexto general de uso de las pruebas. Gracias.
Gracias, doctor. La próxima pregunta es de Nora Gámez Torres, del Nuevo Herald, del Miami Herald. En inglés pregunta, how bad is the situation in Cuba and what is PAHO doing to mitigate it? Doctor Ugarte.
Thank you for that question. COVID-19 transmission is still very active in Cuba. During last week, 63,000 cases were reported in 1 week. That is 3.9% above the previous week numbers, but it's still a higher number, less increase than in previous weeks, but it's still very active. And the number of deaths have increased by more than 20% in comparison to the previous week. And the situation is difficult because of the lack of availability of essential supplies in response to COVID-19, but also essential supplies at all levels of the health system in Cuba. We have been working very closely with the Ministry of Health and the health authorities to identify the more pressing needs. between the end of July and the first week of August, we sent supplies to support the first level of care, but also COVID-19. We sent 5 kits of COVID supplies, but also trauma kits and emergency health kits and some other supplies, including laboratory reagents and others. And we are preparing additional support. But with all this is just limited support. So we are working with the Ministry of Health to identify the most pressing needs, so we can explore also with other donors and countries that are willing to support Cuba in both the COVID-19 response, but also in the other most urgent needs. And I hope that we will be successful in providing additional support to Cuba. It is a very difficult situation, and I think the solidarity of the region is something that we need to look for more. And although we are preparing, as I said, more additional sending 20 emergency health kits, 4 kits for testing also, and trauma kits and pneumonia and other diseases, the needs are too high in Cuba. And I think we will be able to mobilize the solidarity and the support for Cuba and also at the humanitarian side. Thank you.
Muchas gracias, doctor. Todavía tenemos algunas preguntas que esperamos llegar a tomar hoy. Hay varias preguntas todavía en el chat, así que gracias por sus consultas. La siguiente es de Matías Loewi de Medscape en español. Dice, cada país toma sus propias decisiones sanitarias, pero ¿juzgan apresurada o no suficientemente apoyada por la evidencia la decisión de Chile y Uruguay de aplicar una tercera dosis de la vacuna COVID-19? Doctor Barbosa.
Gracias por la pregunta. Sí, cada país hace sus decisiones sobre la estrategia de vacunación que va a adoptar, teniendo en cuenta la disponibilidad de vacuna que tiene, la situación de la transmisión y otros factores. Nosotros, la OPS tiene un grupo de expertos, que es un grupo regional, el grupo de expertos de vacunas, y también tenemos en escala global el grupo de expertos de vacunas de la OMS, que su acrónimo en inglés es SAGE. El grupo de expertos de la OMS ayer lanzó una recomendación sobre el tema de la tercera dosis, llamando la atención que la gran prioridad hoy debe ser alcanzar todas as pessoas que necessitam vacunar. Muita gente não ha tomado todavia a primeira dose em muitos países. Muita gente em vários países que estão com cobertura vacunal mais elevada não tomaram a segunda dose, que é fundamental para garantizar a proteção. E ao dia de hoje não temos todavia evidências para ser uma recomendação por uma terceira dose. Essas evidências se estão recorrendo em muitos países, há estudos, há ensaios clínicos, há dados do mundo real para que se pueda ser uma recomendação no futuro. Para o dia de hoje, não há uma recomendação para uma terceira dose. A prioridade deveria se dar para garantizar que todos os países tenham acesso às vacunas e que ao interior de cada país não se deje nadie atrás. Ou seja, todas as pessoas que estão em condições de tomar a vacuna, la puedan tomar la primera y la segunda dosis. Gracias.
Gracias, doctor. Siguiente pregunta es de Royston Jones de Eyewitness News en Bahamas. En inglés dice, younger people are also dying across the Caribbean and the Americas. We have not seen this in earlier waves. What can this be attributed to? Y Natalia Vitela del periódico Reforma en México pregunta qué impacto está teniendo COVID y variantes como Delta en adolescentes y niños. Doctor Aldiguieri.
Okay, these are already two different questions. Regarding the first question from the Caribbean, it is important to note that during the first semester of 2021, the dynamics of transmission has evolved a lot in the different sub-regions of the Caribbean compared to 2020. Most of Caribbean countries are reporting community transmission with very, very few exceptions. This is a big change compared to 2020. In the Eastern Caribbean, the peaks of transmission have really started after the Christmas period and the relaxations of the international travel restrictions. And at the moment, some countries are even experiencing higher transmission rates than at any time during the last 18 months. In the countries of the Guyanese Shield, as Suriname, Guyana, and French Guiana, there was a huge peak of transmission and hospitalization and death during the second quarter of 2021. This peak mostly related to the surge in the northern part of the Amazon basin. And there are now some concerns following the introduction of the Delta variant in this part of the Caribbean mainland countries. With all these factors that I just shared with you, combined with the suboptimal application of public health measures, suboptimal adherence to public health measures by the younger generation, and a lower vaccination rate. We have to recognize that the vaccination in this age group has started after the other adults. We are observing higher numbers of new cases and higher new reported death. The main message to this population group in the Caribbean is that public health measures apply to all age groups, including the young adults. And the second message is vaccines are now available for young adults. And as Dr. Etienne said, get the vaccine. Now, regarding the question from Mexico, I think que voy a responder en español. Pregunta sobre adolescentes y niños y variante Delta. La evidencia disponible cuanto a los menores sugiere que los niños y adolescentes serían menos susceptibles a la infección por el virus SARS-CoV-2, pero tienen un rol obvio en la dinámica de transmisión. Es lo que se está observando ahora en países que han logrado cobertura vacunal alta en las poblaciones de adultos, tal como en el Reino Unido y en Estados Unidos. Haciendo uso de la base de datos de los países que reportan la edad de los casos, podemos decir que a final del mes de julio 2021, en las Américas, el 6% del total de los casos reportados, este 6% ocurrió en menores. Sin embargo, algunos menores pueden desarrollar un síndrome inflamatorio multisistémico más grave y tenemos reportes desde el mes de mayo del año pasado procedente de 24 países y territorios de la región en las Américas. Y esos 24 países y territorios han notificado 6.809 casos confirmados, acumulados, de síndrome inflamatorio multisistémico, incluidas 134 disfunciones. Entonces, espero haber respondido esas dos preguntas de ámbito diferente sobre el Caribe y más general en términos de adolescentes y niños. Gracias.
Muchas gracias, doctor. Y ya estamos llegando al final de la sesión del día de hoy. La siguiente pregunta en inglés dice, can you provide an update on vaccine donations in the region? And can you tell us more about the role of the revolving fund? Doctora Etienne.
Thanks for this question. So far, 40.5 million doses of vaccines have been donated to the countries of Latin America and the Caribbean. 79% of these are direct bilateral donations, and for 21%, it is through the COVAX mechanism. The majority of these donations, about 86%, have been donations from the United States. And I know that our countries and certainly have expressed their thanks for these vaccines, and PAHO is also grateful on behalf of our countries. Other countries that have donated vaccines include Spain, Norway, Sweden, France, India, Mexico, Israel, and China. And of course, we are also thankful for these donations. All donations are important. Over 8.3 million vaccines that were donated have been shipped and delivered through COVAX, and at least another 2 million are expected in August. PAHO, through its revolving fund, coordinates the delivery, logistics, and the safe arrival of vaccines from the manufacturing sites to the recipient country. PAHO also provides technical advice and support in the whole process, including cold chain, syringes, meeting legal and regulatory requirements. We have a regional plan of action to ensure equitable and sustainable access to COVID-19 vaccines, in addition to the COVAX commitment to provide 20% of vaccines to 35 countries. Our goal is PAHO's goal is to procure enough vaccines to reach 70 to 80% of the population of our countries in Latin America and the Caribbean. And this plan is part of the activity of the PAHO Revolving Fund, which has an important operational role in securing vaccines for member states. And you heard Dr. Barbosa, this we have been doing for over 42 years. The Revolving Fund also procures vaccines, syringes, and cold chain equipment for our country's routine immunization programs. In 2019, the total of this procurement for countries was about $769 million. And despite extreme logistical challenges and increased transport costs between March and June of 2020, the Revolving Fund secured and delivered approximately 24 million doses of the seasonal influenza vaccine to member states in the Southern Hemisphere to protect their populations and to limit the influx of persons with influenza to health facilities. Delivering vaccines during the pandemic is really a complex operation. And PAHO is putting its accumulated expertise to good use in procurement, in handling, and technical support to help member states access COVID vaccine. I want to end by reiterating, access to vaccines is very important. We thank those countries who have donated vaccines, and we ask for more donations. But what is most important is that people get vaccinated and countries utilize those vaccines. Thank you very much for being with us today.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final de la sesión del día de hoy. Recuerden que pueden encontrar más información en nuestra página web www.paho.org/coronavirus. Así que muchas gracias por acompañarnos y nos vemos la próxima semana. Saludos.